Hello, everyone. This is Dr. Heath McAllister, and I am happy to talk to you all today about exosomes and healing the musculoskeletal system. So, musculoskeletal problems, we could call them injuries, you can call it arthritis, tissue breakdown, where the joints and the tissues don't function like they normally should anymore, either from aging or injury. That's what we're talking about today. Classically, these issues were treated with, say, things like physical therapy or steroid treatments, all the way on up to surgery. And all of those things have their place and they all have their advantages and disadvantages. Today, I wanted to talk to you about, can you use exosomes, either by themselves or in combination with other substances, to help heal musculoskeletal injuries? We're going to take a dive into the science and to take a look at what the possibilities are. I'm going to go ahead and share my screen right now. All right. So, this is me, Dr. Heath McAllister. I didn't do an introduction, but I am a naturopathic doctor and a registered herbalist. I have clinics in both Los Angeles and Portland, Oregon, and I've dealt with regeneration of tissues for basically my entire career. It's a huge passion of mine and an area that I have a lot of expertise. So first, let's talk a little bit about what the heck are exosomes. They are not a household name yet, but they are the powerhouse behind stem cell therapy. So everyone who's probably familiar with stem cell therapy, stem cells work by signaling molecules called exosomes. So nearly all cells can release these. They're essentially budded off microRNA fragments from cells. So it is a cell-to-cell communication device, and they can contain microRNA, proteins, lipids, growth factors. It modulates inflammation, helps repair tissues, and influences cellular behavior. So there's been tons and tons of research on exosomes, that purified communication molecule from stem cells, in recent years. So how do they work? Well, they reduce inflammation across the board. So do stem cells, but exosomes are really the mediator of all the stem cell activity. So rapid inflammation reduction, so that will benefit anyone who's actually having active swelling of a joint, let's say recent damage or inflammatory damage, as is the case in something like rheumatoid arthritis or any of your inflammatory arthritis conditions. Suppresses pro-inflammatory cytokines. So cytokines and interleukins are types of cell communicators that can produce inflammation or quench inflammation. In this case, the exosomes quench or prevent the release of excessive inflammatory mediators, thereby having that anti-inflammatory effect. There's a shift with certain subsections of our white blood cells called macrophages from certain phenotypes. A phenotype is a behavior pattern, essentially. And macrophages are very important cells in the body. They can clean up damaged tissue. In the sense, they will gobble up excessive scar tissue and debris and so forth and really clean an area. And exosomes also decrease oxidative stress in damaged tissues. So when you have damage to a tissue, it's struggling, it's trying to repair itself. Um, you have a higher need for antioxidants and decreased oxidative stress in those moments. So enhanced tissue regeneration. So that is what exosomes do. They stimulate proliferation of certain cells. We talked about the macrophages being cells that eat up scar tissue. Well, there's also these cells called fibroblasts. They're the looms of the body. They lay down healthy new tissue. Chondrocytes, they're the cells that produce new cartilage. Tendon cells and myocytes, which are the cells that produce muscle fibers. So those are all the types of cells that make up our structure. Most of all the cells that make up our structure are facilitated by these types of cells to lay down that tissue, that connective tissue. And specifically, the mRNAs, the microRNAs, are delivered. Specific ones are known for promoting cartilage and tendon repair. So essentially, you take the exosomes, you inject them into an area that's damaged or painful, and it stimulates this whole cascade of healing from all these different cell types to join and help heal the damaged joint. Along with directly healing the tissues, there's a huge benefit to your vascular system. So your vascular system is all the blood vessels, the capillary beds, all of the blood vessels that conduct blood from our heart to our periphery and back again. they are improved with exosomes. Exosomes improve a process called angiogenesis, which is the production of new blood cells. Upregulates this thing called vascular endothelial growth factor, VEGF, also very important for stimulating growth of blood cells. Where you have free flow to an area, you're going to have better healing. So really increasing the rivers and tributaries that bring blood and nutrients and oxygen and red blood cells to our injury sites is really critical for them actually healing. You will enhance vascularization in poorly vascularized tissues. So things like tendons, ligaments, cartilage, they don't get good blood flow to them naturally. So unless you do something more concertedly, they're generally blood deficient. And exosomes have been shown to increase blood flow to those important structures. Uh, Reduce scarring. So using exosomes does reduce scarring, both for two processes. One, I already mentioned, that is the macrophages eating up old scar tissue. The other is that they downregulate this one type of transforming growth factor, beta 1. So that can lead to excessive scar tissue formation. Certain people produce excessive scarring, all the way up to a condition called keloid formers. And this is trying to temper that. You want to increase the strength of that damaged tissue, but not so much that now you restrict movement, and you pinch structures. The exosomes also promote organized cellular matrix remodeling. So if you see a tissue that has been remodeled properly, it's like parallel lines, right? Along the stress lines. They're there, little ropes holding the tissues in place. When you have a disorganized matrix, it's like someone poured a bowl of spaghetti. All the threads are interwoven in a way that doesn't make sense and doesn't really increase that tissue strength. So this is super important. You want to, manage inflammation. You want good blood flow. You want good collagen parallel lines produced. Okay, so some of the two most common arthritis conditions that we see in our clinic are shoulder injuries and knee arthritis. So let's talk a little bit about those specifically. So knee arthritis, super common. I mean, anyone who gets old enough at some point is going to have some knee degeneration. There's a bunch of very important structures in the knee that can get damaged either from wear and tear or injuries. They include the meniscus, which is the cushion between the two bones of the knee. It includes the ligaments that prevent forward and backward excursion of the knee. They're the ACL and the MCL. And then there's the suspensory ligaments on the side. Oh, sorry, the MCL and the LCL. It's the ACL and the PCL. But the suspensory ligaments on either side of the knee to prevent wobble back and forth. And then there's obviously the joint capsule, there's bursas, there's other structures around the knee that can get damaged. Well, a meta-analysis, and a meta-analysis is a conglomeration of many different studies put into one to kind of give that summary study more power. And so the meta-analysis showed that with osteoarthritis of the knee, with doing exosomes, you would notice cartilage thickness increased. Okay, that's huge. That's our meniscus. Joint space improvement. When you have degeneration of a joint, generally you get that bone on bone, right? The space is decreased to the point where your bones are rubbing on themselves. This has been shown to increase that functional space. And then all of the scores of activities of daily living, so pain, movement, and so forth, swelling, those were all improved compared to a placebo. They showed pain reduction and improved function, comparable or, and a lot of times, superior to PRP with better long-term outcomes. And then there was shown to be a restoration of chondrocyte homeostasis. Again, the chondrocytes are those specific cells that can lay down new cartilage. And then inhibiting certain enzymes that are in process of catabolism or breaking down of tissue. We want to preserve our tissue, so we want to inhibit those catabolic enzymes. Tendon and ligament injuries. So this would be anything from rotator cuff tears to Achilles tendon tears. There's our ACL and MCL. Those are, again, some of the ligaments, ligaments of the knees that can get injured. So there's a bunch of animal studies showing that exosomes are very helpful for producing stronger tendon, more organized collagen, and so forth. Exosomes have also been shown to help anchor our ligaments to our bone better, which is often a problem with surgery, that you can get these bone anchors that just don't stay or don't integrate fully with the bone. And the exosomes have been shown to really enhance that effect. And overall, faster recovery, improved strength of tendon and ligament, and reduced fibrosis, which is another name for scarring. So, again, great benefits. And with muscle tears and muscle atrophy, exosomes do promote myoblast proliferation. So myoblasts are the cells that produce new muscle. So you're going to have more of those produced, less inflammation, enhanced blood flow to the area, and that's for been observed for like acute muscle injury. Let's say you had a car accident or an acute muscle tear. Um, and exosomes have also been shown to reduce oxidative stress and address mitochondrial dysfunction, which is a huge other topic of why our bodies tend to shut down and not be as efficient when we can't produce enough cellular energy. So, potential uses for using exosomes for muscle recovery would be sports injuries, post-operation recovery, and then age-related decline, because as we age, we produce less muscle and less cartilage. We have less anabolism, which is the process of building things up. As we age, we have less anabolism. Growth hormone is a problem, and testosterone can be a problem, and so forth. So bone healing. Exosomes have also been shown to improve bone healing. So osteoblasts. So osteo meaning bone and blast meaning build. These are the cells that build up bones. So they stimulate osteogenic differentiation, mineral depositions, because we don't just need the bone matrix, we also need to be mineralized with things like calcium and magnesium, the hydroxyapatite that really makes bone strong and dense. Also, exosomes have been shown to improve the vascular supply to fracture areas. Again, like I said, if you have good flow going to an area, you have much better healing potential. And several studies have shown that the healing is similar, comparable to stem cell therapies without the risk of cell transplantation. Stem cell, we didn't get into it yet in this talk, but they have risks of when you take foreign cells and put them in your body, there are certain inherent risks with that. Exosomes are acellular, they're not actually cells, so they don't have that same risk. So you could think about this for fractures, non-union fractures where the bone didn't quite match up and still needs to heal. And then osteoporosis related microdamage. So osteoporosis, thinning or weakening of the bones, particularly in women and postmenopausal women. And that predisposes people for, say, a hip breaking a hip, which can really be a game changer for someone's health when that happens at a certain age. So, exosomes are well established and well known to be excellent for autoimmune conditions for many reasons. One, they're very anti-inflammatory. Two, they're immunomodulating. When you have an autoimmune condition, you have an overactivity of the immune system. And so, a lot of autoimmune therapies are designed to suppress the immune system. And exosomes don't do that, they just balance the immune system better to try and reduce a hyperactivity. So, in certain autoimmune conditions, there are associated arthritises like rheumatoid arthritis. So, exosomes have been shown benefits specifically for reducing synovitis, so like inflammation of the joints and less T cell activation, which T cells are one of the defenders of the immune system that can also damage our native tissues. Disc degeneration. So, in between all the vertebra of your back, you have this thing called an intervertebral disc, and it has a thick fibrous outer layer and then a juicy pulpy inner layer. And when you have a ruptured disc, that pulpy layer can squeeze out. So this is what this is referring to, improving the nucleus pulposus, that soft spongy layer in the middle, and improving its cell survival, so it's going to live longer. So there's so many pathways that exosomes can modulate in terms of an inflammation that are not purely immunosuppressive. So not completely taking out your immune system's ability to function, but to balance it, to balance the immune system. So advantages of exosomes over stem cells. So like I said earlier, stem cells, you're using foreign cells. You're transplanting foreign cells either from placental tissue, it could be other types of tissue, but mesenchymal stem cells from another donor into the body. And when you do that, there is a risk that you're bringing other cells along with it, that it could be somehow contaminated, that you could have. There's been case studies in the literature of people having a type of shock syndrome from there being contamination in that sample. So that's a problem. There are certain risks of having, when you transplant stem cells, that they could potentially produce tumors. Obviously, not what anybody wants. And one thing to note is that while mesenchymal stem cells from placental tissue don't lack, they lack a type of name tag called MHC class 1, they still maintain a MHC class 2. MHC is major histocompatibility complex, and that's basically the name tag on the cells that says, I am Dr. McAllister cells, and you are John Smith's cells. And they don't work well together. If I take somebody else's cells and put them on my body recognizes them as foreign and will try and kill them. That same thing does happen with foreign stem cells. It's a little bit of a delayed reaction because you're lacking MHC class 1, but it will happen. So rather than doing that, if you look at why stem cells have ever been shown to be effective, it's because while they're in circulation, they're producing exosomes. And those exosomes are these potent cellular communicators that tell your body to rejuvenate and to heal and decrease inflammation. So rather than doing stem cell, you concentrate the thing that makes the stem cell work and you give that. It's a pure product. It's not cellular. It doesn't have the same risks associated with stem cell. Can be administered by injection. There's IV treatments. There's various different ways you can do exosomes topically. There's various different ways you can do it depending upon what your end goal is. There's usually minimal or almost no downtime. When I do a exosome treatment on someone's knee or shoulder, I tell them to maybe take it easy for about a week and to not take certain anti-inflammatories because I want the signaling molecules to be active and to recruit all of the different types of cells like fibroblasts and macrophages. And the exosomes are compatible with other types of regenerative therapies like PRP, platelet-rich plasma. In fact, most of the time I do joint injections, I am combining PRP with the exosomes to get more bang for your buck. You could combine peptides, peptide therapies, huge area of research right now, and there's some really promising peptides that do stimulate connective tissue healing. So oftentimes I will combine those. Low-level laser, that would be like red laser, LED light, and so forth. Shockwave treatments and other regenerative modalities are perfectly dovetail with exosome treatments. So really, exosomes are the future. I don't think they're going away. I think we're only going to hear more and more about them. I think eventually there's going to be pharmaceutical companies making their own version of it. There's going to be bioengineered versions of exosomes, but this is the way of the future. So for musculoskeletal injuries, degeneration, sports injuries, anything like that, if you're looking for a potential option for something like surgery, I would strongly recommend you look into exosomes. If anyone is interested in exploring whether or not they might be a good candidate for receiving an exosome treatment, you can sign up on my website. You can go to mcallistermedical.com and you can sign up on my website for an exosome discovery session. 100% free of charge, 30 minutes of my time, and I'll tell you honestly if I think you're a good candidate or not. And if you're a good candidate, you have that choice. It's one of the options that you could consider, along with all the other things we mentioned, physical therapy, drug therapy, certain types of injection therapy like Synvisc. I think it's important that everybody knows their options, and then they make a good informed decision about their health. So I hope you learned something today about how exosomes can help with osteoarthritis conditions. I think that they are the way of the future. I'm excited to be bringing this information and to talking to more patients about this. And if you are interested in exploring how exosomes may be able to transform your health and life, please look in the comment below or go to my website, mcallistermedical.com. Hope you have a wonderful day. Thanks.